For the last 60 years, I've been struggling against that. In the government, when we were outside the government, in the resistance, we were always striving to depend on ourselves. Therefore, this unfortunate phenomenon where people have vaccines and they say, no, we must first vaccinate our own people because it works you Africans. Africans are a disgrace to ourselves. Why do you have to depend on the outside for everything? Life, you depend on the outside. Why? So, even before this crisis, I was always struggling with our people. Ebola started here. We are the ones who suffered from Ebola. Why would anybody else develop the vaccine not of Ebola, not ourselves? Why? This is a big shame for Africa. And within the government, you know what we are doing. We must develop, and we are developing with our Afghan government funding, a pathogenic industry to make even a business out of our diseases. If we are the ones with the diseases, why don't we make a business out of them at the same time as we provide the cure? Now, the only thing I want from outside, if the vaccines come, good. If they come, we shall welcome them. But more important, developing our own vaccine. And I've been following every day what our people are doing. And they can do it. They have the knowledge. We have trained you. Many of you are highly educated. Ugandans started education long ago, modern education. The only little issue I would like to ask from our German friends and other friends, if they want to help, are sometimes the raw materials for this vaccine. Because of the economies of scale, sometimes it is not economic to produce every raw material, it's cheaper and quick to get some from us. So give us those inputs to discuss frankly. Let's get the support of input. We shall pay. We don't want to. For me, I don't want any donation. No, I will pay. But if I want my people, for instance, I will give you one example. My people wanted cells to grow the virus here. These cells apparently originally came from the African green monkey. Apparently the green monkey has got some cells which are good for growing the virus. clever outsiders took the cells and multiplied them. So when I quarreled with my people, I said, you people, how can you sit here as if you are imbeciles? That we are dying, we are waiting for foreigners to come and save us. We shall die until the foreigners come to save us. What sort of people are you? And you are trained. It is the orientation. It is a slave mentality. My people now started trying to get the cells now. They are nowhere in Africa. You can imagine in the whole of Africa, there were no these green monkey cells, which originally came from Africa. And my people started looking here, looking there, looking there. A lot of struggle. And some were wondering, you Africa, what do you want the cells for? You stay there and wait for other people to make the vaccines. I said, no. We must get them. If we don't get them from the ones we think are friends, we shall find another way of getting them. And we got them. So my people now are moving. But they need some other raw materials. Even this morning I was checking with them. Please, if you really want to help Africa, get those raw materials. We shall pay. I don't want any help from anybody. I will pay. I will pay for the vaccine if it is already done. I will pay for the raw materials. 1.5 years we shall be standing up in all these areas. We shall be having our own vaccine. We shall be having, we already have our own diagnostics. We already have the therapeutics. The therapeutics. We may help the world. We are moving very well there. The therapeutics. So therefore, for me, there is this prepared speech here where I say I'm happy to see you and so on. But I'm telling you my thinking now. So this selfishness in the world is bad, but it's good. I like it because it wakes up Africans. It wakes up Africans. It's a shame that the whole of the African countries is just asleep, waiting to be saved by others. If they don't save us, we shall die, like happened with the slave trade. How can this be? Slave trade went on here for 400 years. These idiot chiefs were here just putting on monkey skins and so on, looking like clowns. So therefore, although this is bad, but me, there is a good thing in it, to wake up the Africans. So I go back to the written speech now. We know, do I have to go with, I end here? Have I not finished? Let me read what they have written here, just in case I forget something. We know that the ultimate solution to COVID-19 lies there is a new variant which is now you tell me how you handle that mutation of the virus. The government, with the help of the African Union and other partners, will fast track the acquisition of sufficient doses of vaccines to cover the entire population, alongside efforts to develop our own vaccine. That one is the one I am really working on. We are continuing to talk with India, the USA for the Johnson & Johnson vaccine, China, and Cuba. The importance of medical research cannot be overemphasized. Progress in medicine depends largely on the work of medical research. Research into the causes and treatments of illnesses is perhaps the most important weapon in the fight against disease. As you saw in the new government, I transferred that ministry to my office, the Minister of Science and Innovation, because I was not happy with the red tape by those who were involved. We would be very far on the vaccine if we had not wasted our time. Research into traditional medicine is particularly important in Africa in making good use of our naturally and richly endowed environment. This part of our world has got all the biodiversity, and since ancient times, those people who are sitting with you, my guests from outside, these Ugandan scientists, many of them are from the countryside. And in the countryside, our people have some indigenous medicines. Now, what is happening is that because these people get scientific knowledge through education, they then go back, say, oh, but our people were doing this. What was in it? And you will be surprised about the potential there. The potential is quite big. Now there, we need to agree on the patenting, because of course this is not the one who brings the indigenous knowledge and makes it available to the wider society, to the wider world, does something this in terms of patenting. So the countries in Africa, Asia, and Latin America use traditional medicine to help meet some of their primary health needs. In Africa, up to 80% of the population uses traditional medicines for primary health care. The age-old cures that kept our forefathers disease-free must be given enough attention so that we improve on them and preserve their use. The government remains committed to funding research and innovations by our scientists, especially those in the university. We have demonstrated this by investing of billion. The government remains committed to funding research and innovations by our scientists. Research and Innovation Fund this is for Makerere alone, I think. However, I challenge Makerere not only publish, but translate research into products that spur our industrial development and catalyze pharmaceutical industrialization to stop the massive dependence on outside pharmaceuticals. We want tangible results, and our ordinary Ugandans have hope in our scientists to come up with solutions for different ailments like cancer and many other diseases. With the facts has been tried among some patients, and most of them have fully recovered, while the others are still on treatment. That's for one. For one, we target to reach 124 patients before we are sure that this medicine treats COVID-19 patients. I salute the few outsiders that helped us. I therefore appeal to our regional scientists to work together and put up a united front. Making a vaccine involves 9 or 8 phases. If WHO allows you to skip one phase, our researchers are now entering 5. We hope to get to stage 8 by November 2021. One phase. Our researchers are now entering stage 5. We hope to get to stage 8 by November 2021. I can assure you that by the end of 2021, we shall no longer be waiting for outsiders to rescue us from mass death. The role of science is recognized from innovative, built enterprises and industries to produce goods, services, and goods to address societal challenges of the world in the case that science, technology, innovation, and research enabled improve product quality and gain a competitive advantage. While civilization started in Africa, the problem was that it was never institutionalized and regulated. It remained an individual tribes skilled trade. For example, we have skilled people in Uganda called Abahesi blacksmith. This is a whole industry that has not been developed. Mineralogy, gemology, the science of dealing with gemstones, as we continue exporting our minerals in raw form. This may also explain why we have missed the first, second, and third industrial revolutions. As Mwalimu Nyerere said, Africa needs to run while others walk if we are to catch up. Some parts of the world are on the verge of the fourth industrial revolution, while many parts of Africa have not entered the first revolution. As we usher in the fourth industrial revolution, where the physical, biological, digital technologies are converging, we are seeing technologies like artificial intelligence, robotics, biotechnologies, etc. These technologies are efficient and can innovatively be used to address societal challenges. For example, scientists have used modern biotechnology to come up with plant varieties that are resistant to drought, pests, and disease, and rich in nutrients through biofortification. Technology and innovation are very dynamic, and developing countries cannot afford to lag behind or to go through the whole revolution cycles to the fourth industrial revolution technologies. It can only be possible by establishing strategic partnerships with the advanced countries like Japan. All the countries that have transformed their economy have done so through deliberate and focused strategic partnerships, such as Japan, working with the USA. China and Korea have all leveraged strategic partnerships and technology transfer in the field of science, technology, innovation, and research. Finally, I wish to assure everybody that we are optimistic and we shall overcome this challenge of COVID-19. As I have mentioned several times, our scientists, doctors, researchers, innovators, etc., will move Africa to another level scientifically. It is now my honor to declare the World Health Summit regional meeting in Uganda officially open. I wish you all a good stay and fruitful proceedings. I strongly urge you to continue observing the COVID-19 standard operating procedures. Thank you very much. God bless.